Bonsoir, bienvenue, Tanzi, good evening, welcome. I'm Senator Marilou McPhedran, and it's both my pleasure and my honor to host this evening with civil society leaders. And I want to begin by acknowledging with gratitude that I was born and raised in Manitoba, which is, by the way, the geographic center of Canada, although people in Ottawa have a very hard time believing that. And that is Treaty 1 territory, and it is also the homeland of the Red River Métis Nation. And also that we are here in the parliamentary precinct in Senate buildings, and that means that we are on the unceded, unsurrendered territory of the Algonquin and Anishinaabeg peoples. They have gifted us with the honor and the responsibility of being on this land for our parliamentary purposes, and we are grateful. I want to ask if my co-host for the evening, Dr. Felix Munger, would join me. I do want to acknowledge colleagues, two senators that have joined us, Senator Mary Jane McCollum and Senator Donna Dasco. So I think at this point I'm going to very thankfully turn this over to Dr. Munger to be the co-moderator for the evening.
Welcome.
Okay, welcome. Bonjour à tous. Je m'appelle Felix Munger, and I'm the Executive Director of the Canadian Centre for Safer Communities, formerly known as the Canadian Municipal Network on Crime Prevention. The Canadian Centre for Safer Communities is a national membership-based not-for-profit organization representing currently over 150 communities. And by communities, we mean cities, towns, regions, and Indigenous communities. We were created about 20 years ago by practitioners, for practitioners, and we support communities from coast to coast to coast to increase safety and reduce crime and violence. We do this through training, providing evidence-based technical support, and facilitate exchanges for practitioners to share their practices and their experiences and their learnings. My colleague Audrey Monette and I are thrilled to be here and to co-host this event with Senator McPhedran. Thank you. Irvin Waller has been a colleague and an ally to the Canadian Centre for Safer Communities for over 20 years. He has been and continues to be our go-to expert on evidence and one of our strongest cheerleaders. This, today, is an exciting time for violence prevention and community safety in Canada. For almost 10 years, I had the pleasure to watch communities move from relying largely on enforcement to finding their voice and role in addressing safety and recognizing the advantages of multi-sectoral approaches to crime prevention and community safety. In fact, today, Canada is seen internationally as a flagship country using evidence to build community-wide comprehensive safety plans and working on ways to monitor safety by moving beyond relying solely on crime data. And I'm proud to say that the Canadian Centre for Safer Communities has and continues to play a vital role, a pivotal role in this achievement. Can we do more? Sure. Should we do more? Absolutely. I think each of us has something to contribute. Some of us have resources, like ourselves. Some of us can champion this work. I think there's lots of people in the room that can do this. Some of us have the evidence, like Irvin Waller, who's here and going to speak to this. And others, like the panelists that we're going to have, run very successful evidence-based programs. And finally, we, at the Canadian Centre for Safer Communities, support cities and communities with technical support to make the best of their current situation with their often limited resources. Safety is the role of the federal, the provincial and territorial governments, as well as enforcement. But, more importantly, it is also the role of many social service organizations, private industry, residents in communities, and each and every one of us. And it is together that we'll be able to make every city and community in Canada safer using comprehensive strategies and evidence-based programs. Thank you for having us, and with this, Irvin, it's over to you.
Thank you so much for organizing this event, Senator McPhedran, and thank you, Felix, for that introduction. I'm going to go straight forward. You've seen the title. In simple terms, we have the knowledge and we know the essentials and we have the will to reduce violent crime in Canada by 50% in the next 5 years. If I was in government, I would use a title like the one that's here. Significantly reduce. But let's see why I have confidence about that 50%. So, first of all, what we're doing doesn't deliver. Yes, we need police to respond. We need to hold people engaged in violence accountable, and we need to stop them from doing it again. But this, for me, is tragic. The country that is so proud of its safety has the police responding to over 500,000 violent incidents and rising. That's something in terms of rates that we only knew in the early 2000s. The homicide rate for Indigenous is 6 times that for non-Indigenous. For blacks, it's 5 times. You can't solve the over-representation of Indigenous people in prisons in the prison system. You have to do it some other how. Rates of gender-based violence are thought to be epidemic, and we are spending more and more and more on policing. Not actually on more policing, just for the same rough levels of policing. And we have jails overcrowded in different parts of Canada, and our courts are so behind. So, why am I so confident that we can make a difference? I had the opportunity to look at these portals that cover the globe. And about 3 from the bottom is Crime Solutions. This is the US Department of Justice portal that shows you. It has over 100 things that are proven. I don't know anywhere in the US that is actually using these. I don't know any decision maker in the US who's aware of this, and I certainly don't know any decision maker in Canada who is aware of this. If you go down to the bottom, you can see the World Health Organization. In 2017, they launched their portal right here in this city. It was the Public Health Agency of Canada who did it, and I won't go into who wasn't there, but that portal is incredibly important. Both of those show us that violent crime is eminently preventable for affordable costs. So this is just one of the figures that I've chosen from the book. And you'll see here that it starts with outreach to young men, and you're going to be hearing from Yesi in the panel. Yesi is largely consistent with what's there. I like the youth inclusion programs because it doesn't involve police enforcement, it involves referral. And this got, whatever it says there, a 65% reduction. Hello, 65% reduction, and we're not doing this coast to coast here. That's what this book is about. If you go down a little bit, you will see some stuff relating to, I can't actually see these, so I'm going to have to turn around. So parenting and early childhood, incredibly important, but mostly long-term. You have to do it, but don't expect results tomorrow. Hospital-based, it's come to Canada. St. Michael's, Sunnybrook in Toronto, and there's a hospital in Montreal. Basically, victims, stabbed, shot, whatever, when they go to the hospital, you outreach to them. We should be doing this in every trauma hospital from coast to coast to coast in Canada. So we also need to be doing stuff in schools and early childhood. We're very lucky to have the founder of Stop Now and Plan, who will be speaking very briefly, but she'll be very much available to talk to you as one of the things that we could be doing. Life skills, cognitive behavioral, the Americans like cognitive behavioral. So I think this is enough. You just have to see there, I haven't given you all of these, but 50% is achievable. If you looked at the stuff on returns, you would have seen, and I'm going to come back to returns in a moment. On gender-based violence, we have Fourth Hour invented in Canada, gives you roughly 50% reduction, says there's 62%, and we know stuff that can be done in schools. This may not sound to you like stuff that's going to stop intimate partner violence. There are other things in the book that will. Shakespeare said, an ounce of prevention is worth a pound of cure. We are spending way more than a pound in weight or in money on cure, and we're not spending that ounce on prevention. Just for those who aren't brought up in the British system, that means 1 for 14. People used to say 1 for 7. It's 1 for 14 today. So the book talks about how you actually put this into practice. So Public Safety Canada has scattered some small projects. They're good projects. They're evidence-based, but they were all time limited. Often for 3 years, you know, the minister goes in, there's $3 million in Toronto. These projects are great, but you're not going to bring violence down in Canada from a few isolated projects, even if they are SNAP, even if they are YACI, even if they are to do with gender-based violence. You have to do this on a national scale. Now, these 7 essentials were invented in Canada. Yeah, in '96 they got help from the French, and they got an urban safety set of recommendations. In 2002, there was an International Centre for Prevention of Crime in Montreal with support from Public Safety Canada. They identified essentials, and they weren't the only people to agree with them. The Americans agreed to them. The French, the British, the Germans, the South Africans, and many others. They went through and were adopted by all nations. These are what we need to be focusing on. Now, if you look at what we're doing in cities, and you've heard Felix talk about cities, there are people here who work in cities, and there are people who work at the local level. It's interesting to apply those essentials to cities. And yeah, Boston, famous in the 90s. By 2000, their homicide rate was back up. 2012, they reinvented it. 10 years later, their homicide rate was back up. I'm going to tell you that they're actually doing some things right now, but they weren't able to sustain it. Glasgow, they set up a violence reduction unit, top of that list of essentials. They diagnosed the problem. They looked at what has worked. I'm not sure whether they looked at crime solutions or what, but they certainly looked somewhere. They may have looked at my material. I was very much involved in the background. And they got a 50% reduction within 3 years. That's what we can do in Canada. If Glasgow can do it, we can do it. And Devon is going to tell me, well, these were white on white. Actually, white on white in Glasgow are almost identical to black on black in Jane Finch, but for the color of their skin. And they reduced violence by 50%. So there's some good news. Ontario, Yassa Nakvi is going to be joining us. He was the Minister of Corrections or something like that in Ontario when they changed the Police Act, and they required every municipality and local government, indigenous or whatever, to develop a community safety plan. And I'm not going to take you through the details, but you can see the bullets. Diagnose the problem. Come up with a strategy likely to work. Measure results. Wow. The Mayor of Toronto is actually doing this. Not enough to make a big difference yet. She said, after a particularly horrible violence incident that made the headlines, I want a public health and a scientific approach. I want what has worked in the past. I want to expand those things that work. I want to track results. I want to be inspired by Glasgow. If we could get every federal politician who is involved in public safety issues to make the same statements, this country would go back to being a safe country with a homicide rate closer to Europe than to Chicago or Mexico. The UK, Glasgow is still in the UK. They didn't just sit back and say, oh yeah, we've got something that worked. They've cloned it to 18 to 20 areas. 18 to 20 areas. All of those have the top thing identified in those resolutions. A violence reduction unit, the brains, to diagnose, to look at what's known, to convince the politicians to put the money in, to measure the results. And they're getting results. It's not 50%, but it's getting there. And why is it getting there? Because they're evaluating the outcomes of a national program. Not that little important project that went on, a national program. And they're getting not just reductions in police, but also in hospital admissions, in injuries. And that's actually what's most important to me. If you can reduce the trauma, injuries, and pain from violence, then you're going somewhere. So the Mayor of London, tough on causes, tough on crime, re-elected with a huge majority. It is wrong to think that the only way to be elected is to argue that we need to make prisons tougher. That will not reduce crime. You only have to look in the United States to see that it doesn't work. What you have to do are the things that people want. Yes, they want some accountability, and they want people to tackle costs. 2-to-1 in the US, the opinion polls. Senator Dasko is with us, who's an expert on opinion polls. We haven't done these recently in Canada, but if it's 2-to-1 in the US, hey, it's 2-to-1 here. So they've also put 350 million over 10 years into proven solutions. I don't know why they didn't use my book, because it's actually pretty well identical to my book. But if I was living in England, I would like 35 million a year for doing what I do basically for free today. And if you look at, these are taken from their website, and these are almost identical to what is in the second part of my book. And they're trying to create a movement. I want us to create a movement, but we need government help to create a movement. The people who come and listen to me are part of a movement, not just here, but across from coast to coast in English and French. Yes, there's a movement there, but you can't make prevention happen on the back of an envelope. You actually have to put serious funds into it, serious funds. I didn't say 20 billion, but the right-wing Horner, almost 30 years ago, said put 5% in. So if he wanted 5%, we should be putting 10%. And yes, I will compromise for 5% in the first year, but we need to put real money in there. So the White House, they're doing this. Kamala Harris, a district attorney in San Francisco, the Attorney General of California, she has set up one of those offices for violence reduction. It just made me sick to see that the United States was doing this before we're doing it. We need to have a senior official. That means a minister who has prevention, not a vague term like public safety, where he's in charge of enforcement and corrections and the border, but where he's really in charge of the things that will make us safer. And in my view, the person in charge of prevention should only be in charge of prevention and should be at the deputy minister level and should have a budget. Yeah, 5% of what the federal government spends on the RCMP and corrections. That's enough to invest in the things that we need. I referred to Boston. They actually got the message. You have to look at what works. They organized a workshop with some folk who do the same sort of things that I do, and the mayor promised a 20% reduction. Hey, anybody can get a 20% reduction who actually uses evidence. So she wasn't risking anything. She actually got an 80% reduction. I think she actually had some good things happen. I don't claim it was all those, but they were doing the sort of things that SNAP does, and they were doing youth outreach, the sort of things that YESI does. So I hope I'm within my time.
You are.
But here are the bottom lines.
You have 2 minutes.
Okay, I have 2 minutes. So it's simple. You have to do what Horner told us to do 30 years ago, what the Americans are doing and what the Brits are doing in their own way. We have to have an Office for Violence Reduction, call it something else, Office for Violence Prevention, or Office for Violence Prevention and Community Safety, or Office for Victims and Community Safety. I don't know what you should call it. I just know you need that person there. And that person has to have staff who know the sort of stuff that's in this book. And they have to have a budget to invest in accelerators. The second point is an accelerator. If we had community safety planners like Felix's group, and we have Audrey here sitting in the front, but they advise, they go in and advise. We need people actually working in cities, in indigenous communities, that know this sort of stuff, and they know how to put it in, how to measure it, how to sell it, It's actually not that difficult to sell prevention, but you have to not compromise for short-term projects and low budgets. You have to make sure you've got enough money to actually bring the indicators that the federal government puts in its report, where it's losing. It does not achieve those indicators. And the third point is we have to go from projects to adequate and sustained funding. And this is not just the federal government, it's also the provinces. And I actually think Ontario is moving in that way. I hear rumblings in Toronto. When I go to Toronto, there's interest in actually putting real money in. And it has to be real money. We're spending roughly 25 billion in Canada on reacting. And as you've seen from the slide, that costs the victims of crime more than 100 billion a year. If we could just put 5%, it sounds like a lot of money. I didn't say the federal government should be putting 5% of that, which is a bit more than $1 billion. I think they need to take 5% of what they're spending and put it into this and encourage the provinces to put 5%. The cities, even Olivia Chow can't do this either on her own in terms of money or in terms of knowledge or in terms of her office. So thank you so much.
That was really inspiring, Dr. Waller. I think that the practicality, the achievability, the emphasis on measurements, enormously helpful. That's kind of the way we have to be thinking as parliamentarians and as community leaders and as researchers. So the key points that you left with us, really, I think we're starting our panel discussion from hearing about highlights of recent successful innovations that are actually working. And for this panel, we're absolutely delighted to welcome, and I'm going to ask as I introduce you if you could take your spot on the stage, and then I'm going to turn it over to Felix to moderate the panel. So I'd like to welcome to the Senate of Canada, Dr. Dana Augimeri, the co-founder and developer of Stop, Now and Plan, better known as SNAP, and some of you may be familiar with the Snapdragons that are very popular when they're handed out. And this is, we can say quite accurately, an internationally recognized, proven, and cost-saving strategy to stop crime. Dr. Augimeri, if you join us, please. And then next I'd like to welcome and introduce Devon Jones, the founding director of Academic, Sport, and Character Education. I believe the acronym is YACE. And the evidence-based program to stop Black youth involvement in violence in, if I remember correctly, our conversation in the Jane Finch area of Toronto. If you could please join us for the panel. And next I'd like to welcome Heidi Illingworth, who is a board member of the International Organization for Victim Assistance and our past federal ombuds for victims of crime and victimization prevention as a victim right. Please join the panel, Heidi. And I want to now introduce a doctoral student, doctoral scholar, Jeff Bradley, and thank you very much, Jeff, for all the background work that you did with us to make this evening possible.
Thank you for having us. So I'm Lena Mary. I'm from an organization in Toronto called the Child Development Institute. It is a multi-service organization that has been around for over 100 years. It has 3 wings to it. It has a child and youth mental health service, it has gender-based violence services, and child care services. And CDI has an established track record of success in children's mental health, program development, innovation, and really basically trying to develop evidence-based or evidence-informed programs that are cost-effective, scalable, but also culturally responsive and relevant, using a science and action framework. So one of the questions they asked is, what is our organization doing to advance or end violence? And so for the past 40 years, I've been honored to lead a team and develop a comprehensive mental health and crime prevention framework. How do we get kids to the door and youth in a timely manner, assess them for a level of risk and need, and provide an evidence-based service like SNAP using measurement-based care, ensuring the right program fit, dosage for efficiency and effectiveness. SNAP is an evidence-based premier children's mental health and crime prevention model that is scaling worldwide, as we heard the Senator say, but it started in 1985 to fill a gap in services when Canada raised the age of criminal responsibility from 7 to 12, and I was part of that, as well as a number of other people in Canada who chaired that. So we use unique and innovative ways to enhance SNAP's impact. For example, between 2017 and 2021, we launched a national expansion using a unique framework called venture philanthropy. We know government can't keep doing this alone, so we brought together government, the philanthropic community, and the business sector to help create massive social change. And despite the pandemic, we were supposed to reach 100 communities. We actually reached 160, despite the pandemic, and over 10,000 children. Currently, we're in the middle of a new strategy 2.0, and it's really thinking about outcome-based finance, which is a little bit hard to do in children's mental health, but we're trying that. Building capacity and efficiencies to ensure sustainability within SNAP sites and communities. And really the question was also then, what does your organization need to accelerate violence prevention action and practice? We need cross-sector partnerships, academics, government, community, justice, education, families, and child welfare to drive a community level approach, and also a joint municipal level task force for all stakeholders, as we heard Dr. Irvin talk about. An outcome-based finance model really we're looking at to support the scaling, because as Irvin said, you can have these great programs, but if you don't do good implementation science, they'll die. And you're losing so much money. So long-term secure funding for implementation, which is often overlooked, and ongoing research and evaluation. We're only as good as our data. And I'm worried that we're somehow not thinking about data anymore. And I don't know why or what's going on with that. Lastly, we need to fund and bring SNAP to every community across Canada that needs it and wants it. We know that we can save millions and billions of dollars in mental health, criminal justice, and other things like employment, victimization, and gender-based violence. For every dollar you spend on SNAP, you can save up to $56 in criminal convictions costs alone. And SNAP has an 86% likelihood that benefits outweigh costs. So what I'd like to say is it costs $1.5 to $6.5 million for one serious, violent, and chronic offender. And if I'm going to leave you with anything, I want you to think about this statement. 7 years of warning, 7-year incubation period. Kids who end up in court at 14 and a half for committing a serious violent offense, you go back, any kindergarten teacher can tell you, I was concerned about that child. By the time they're 9.6, they are engaging in theft and shoplifting, for example. Just before their 12th birthday, they commit a serious delinquent offense, and at 14 and a half, a serious violent offense. 7 years of warning, 7-year incubation period. Think about how many individuals cross that child's life in that span. So we need to do better when it comes to the well-being of Canada's children, youth, and families and communities. We have proven solutions, like Irvin has discussed this, so let's start using them and implementing them. Thank you.
Good evening, everyone. Bonsoir. My name is Heidi Illingworth, and I am currently the Executive Director at Ottawa Victim Services. I use the pronouns she, her, and elle. Ottawa Victim Services is a community-based agency. We operate 24/7 in the community to provide crisis intervention services to victims of crime and tragic circumstances. Last year, our agency served 4,268 clients here in the Ottawa area, and approximately 51% of our caseload is gender-based violence. And so I'm talking about crimes like intimate partner violence, I'm talking about criminal harassment, sexual assault, and human trafficking. And so I'm a little bit different than Devon and Lena because I'm primarily working in response to violence. We are intervening in the aftermath, but my staff also do really important work with our clients to prevent re-victimization incidents. And so they do a lot of individualized safety planning with our clients. They provide home and personal safety alarms to make their places where they live safer. We provide emergency temporary accommodations and financial assistance to help people escape violence and rebuild their lives. And so in my frontline work over the last 25 years, one thing that I can tell you certainly that almost every client that I have spoken to, every survivor, has said to me that they don't want what has happened to them to happen to anyone else. And so that is why I continue to do this work as an anti-violence advocate, and I consider myself a preventionist now, thanks to Dr. Waller and all of his hard work. But I really do feel like I have a duty to lend my voice to initiatives that are proven to prevent further victimization and harm in our communities. And so that's why I'm here. I do think that my agency can do a little bit more. And so we're looking at hopefully in the coming months adopting a bystander intervention campaign that we are going to borrow from our friends in Lanark County. They did it in the rural context, and it's called See It, Name It, Change It, and it's about trying to tackle the epidemic of intimate partner violence. And so we'd love to adapt that for the urban context here in Ottawa and see if we can reduce the number of clients that we're seeing at Ottawa Victim Services, because that's what we want to do, is work ourselves out of jobs in this field, right? So I'm really excited about this important work, and I will end there.
Okay, you have more time.
Good evening, my name is Devon Jones. I'm the founding director of the Youth Association for Academics, Athletics, and Character Education. I'm a school teacher by trade. I taught in Jane and Finch for over 2 decades, and in my time as a teacher, I just had a lot of concerns around the disproportionality of young people that was victimized through violence as victims or perpetrators. So my urgency caused me to start looking at how can we, one, prevent, and how can we, secondly, intervene. I worked aggressively with the school boards and aggressively with government around putting such structures in place. As it stands, Black youth make up 4% of the population nationally, but are 50% of homicide victimization. As it relates to the province, we're 5% of the population, but over 25% of homicide victimizations. So those numbers are staggering, and they're always concerning to me. So in the work that I lead, whether it's with the City of Toronto and the Towards Peace Initiative, or with the federal government in Peace Corps New Narrative, Towards Peace is a risk intervention program that target those who are the core of producing violence. So the young people engaged in this culture of reciprocal violence, it's back and forth killings. We identify who they are, we connect with them, whether they're in the clinical setting in the hospital, whether they're in community, through social media, and ideally in institutions. So we connect with them where they are and try and de-escalate whatever the issues might be, whatever the tension might be. Peace Corps New Narrative, our federal initiative, is a bit different, and it deals with family support, learning education, employment training, case management, public safety, and expanded opportunities in athletics. So in a place like Jennifer, only 3% of those kids have access to structured recreation and athletics. We want to make sure that we can micromanage the trajectory of young people. For example, I met with the Minister of Education today around addressing things like the gaps in achievement. How can we ensure students are better learners, right? If only 70% of black students are achieving at the provincial standard in math at the grade 9 level, we're going to have a problem moving on. So every step of the way, we micromanage the academic trajectory of young people, we micromanage the safety aspect of young people, and every step of the way we try and provide them with first world opportunities. So that's also a very, very important pillar. In my time as a teacher, I can't tell you, I have a stack of like funeral programs that I want to keep in my bag with me at all times, because it reminds me of the urgency of the work that we do. And one of the difficulties in the work that we do, piggybacking on what Irwin said, when I came across Irwin's book, I was like, wow, this is incredible. You know, I hit him up right away on LinkedIn or whatever the platform was. But I had to connect with him because you rarely find folks who are forward-thinking, who is assessing, evaluating, and can speak to this issue in a very concrete, tangible way. For me, the most difficult thing is seeing a young person in my classroom sitting in front of me, and the question is, at grade 6, 7, 8, it's not if but when. Just imagine that. And I've seen that over and over and over and over. I know what that young person is going to be if the appropriate structures, mechanism, resources, intervention plans isn't put around that young person. So if you live in a neighborhood, just imagine you live in a neighborhood where you're in essence a victim based on your postal code. So even me as a teacher, I work with kids north of Finch. So I know I'm a target for other young people that might have an issue with those kids that I taught and work with a coach, right? So, and I'm an adult. So just imagine you're a young person, and based on your postal code, you can be killed leaving your home, going to school, coming home from school, going to work. And we've seen so many instances of that. We're making an amazing documentary with with an incredible filmmaker at the back, Rico King, called Our Reality. And we have documented young people, 15, 16 years old, life-altering injuries, crippled, paralyzed, just random and indiscriminate traversing communities. So you live in a postal code, and that has an issue with other young persons, and other young persons will traverse to that community and victimize anyone that they see. Could be a grown man going to work, or could be a young person coming home from a basketball game, or on his way to school, or etc. So those are some of the issues that we're dealing with, and every step of the way we are aggressively addressing those exposed, those affiliated, those involved. So every step of the continuum, those exposed to this violence, because exposure creates a plethora of concurrent disorder, because if you live in a community where you're constantly navigating your mortality, you think about the mental impact that might have. Those kids are hypervigilant, they take safety into their own hands, which oftentimes we don't want. So those are urgent issues to us. So every step of the way, the piece around, prevention, intervention, interruption, we are aggressive, we're vigilant. I have a team of 22 people they're in grounding community, they knock doors, they're in correctional institutions, they're at hospital by bedside, they're in schools, addressing these issues, addressing these young people, de-escalating conflict, etc. Felix, you're coming close. I can talk for 3 hours. But for me, this issue is passionate because I'm passionate about this issue because, as I said, it's hard to see young people, and you know, it's not if but when. And I have great success stories. My ED is a kid that came to my program. He's a professor at Laurier, and he's also executive director. A lot of my staff, social worker, teachers, they came through a program. But it's the ones that we lose. I got into the NBA. I got a young man in Boston, O'Shea Brissett, that came through a program. I coached him when he was in grade 5, 6, 7, 8, 9, all the way till he went to school in the States. But those aren't the ones that haunt me. What haunts me are the young men who I know it was a matter of fact of time, not if, but when. And we couldn't do anything about addressing their subsequent demise. So I want to go.
Thank you so much.
So hi, I'm Jeff Bradley, and I'm a PhD candidate in legal studies at Carleton University and a community organizer in Ottawa with a specific focus on violence prevention and transformative justice. And I worked for a number of years too at Public Safety Canada's National Office for Victims, so the victim piece is also really important to me. So I've had the pleasure of working with Dr. Waller since 2015 to research and communicate knowledge on the effectiveness of violence prevention. We worked together on a series of action briefs for decision makers in both English and French for the Canadian Centre for Safer Communities that are very much still relevant today, and there's some copies at the back. I want to share with you several initiatives which I was involved with to accelerate violence prevention, just sort of thinking of it through a lens of the next generation. So in 2021, a group of NGOs and academics and practitioners put a petition together to the Government of Canada that received over 1,077 signatures. We called for making Canada safer for all by using evidence-based interventions to achieve significant and measurable reductions in victimization, including the establishment of a permanent office for violence prevention reporting to the Prime Minister to spearhead actions with all relevant ministries in partnership with the provinces and territories, municipalities, and Indigenous peoples. We also called for the redirection, the equivalent of 10% of the current federal expenditures spent on policing, courts, and incarceration towards adequate and sustained funding for effective local prevention programs. In 2022, we advocated for a national violence prevention action plan, not just a pathetic strategy that we have right now, by presenting the evidence, best practices to the National Associations Active in Criminal Justice, which is Susan's here, government officials and leaders in the public safety, health, and justice sector. In 2023, we also created a 2-minute video on how Canada could halve violent crime in the next 5 years, and we wrote a number of opinion pieces in The Conversation and the Ottawa Citizen to garner attention and support for community safety planning. All of these have emphasized the unnecessary harm caused by violence to survivors and communities, and so the need to expand prevention focused on the root causes of violent crime, which will reduce it significantly and cost effectively. Our list of actions include social outreach to those most vulnerable, youth development programs, trauma therapy, mentoring, job training and sports, positive parenting, and addressing negative social norms that will prevent violence. We agree that the Government of Canada must commit to preventing violence with a Violence Reduction Office, sustained investment, strong planners, and evaluations. Lastly, more recently, I co-organized 2 8-week workshop series with over 40 people, and I trained them on transformative justice with a significant portion about how facilitators could engage in community-based violence prevention techniques to address conflict and harm before it happens. So for those that don't know what transformative justice is, it's about addressing structural inequalities, not just individual failings. All of these resources and tools are available on the link tree, so there's a little scanner at the back if you want to use your phones. And yeah, you're all welcome to also email me or take a look at those resources. And I just wanted to last say that Professor Waller, it has been an honor to work with you over the last 10 years and see how your tireless efforts will shape the future generations to push for better social policies and the prevention of violence. Thank you.